You know, I think in an attempt to calm public fears, you're hearing things like it's a mild illness, this is like flu. It's not really the case because this is an unusual virus. For many young people especially, it is a mild illness, but we're seeing some devastating things. And we got a heads up about this from the Chinese. They actually informed us, and we knew it was coming. Nursing homes. Look what this virus did in that nursing home in Kirkland, Washington. It rolled through it like a train, right? It's at least 7 deaths so far in a nursing home of about 100 people. So this is like the angel of death for older individuals. We need to go back and support all of our nursing home. I don't know what we're doing wrong, but clearly that nursing home is not prepared for this, and I'm going to guess nursing home across Oklahoma are not prepared as well. Also, our healthcare providers. We saw in Wuhan 1,000 healthcare providers got sick, and we had at least 15% severely ill and in ICUs. And that is very dangerous because not only do you subtract those people out of the healthcare workforce, but the demoralizing effect of colleagues taking care of colleagues is going to be devastating. I mean, the whole thing can fall apart if that starts to happen. We saw this with Dallas. So I was on Governor Perry's task force for infectious disease, and those 2 ICU nurses, when they got sick, it was really devastating. And finally, the governor had to call the Health and Human Services Secretary, CDC director, said, look, normal ICUs can't take care of these patients. We've got to get them out of here. So you don't want to see those kinds of situations. I'm worried about our first responders. We're already seeing in Washington State how they're already in quarantine. So does that mean we're going to have to bring in the National Guard? I think that's going to be another big issue as well. So those are the 3 vulnerabilities that I see right now in a place like Oklahoma.
And how should our constituents back home react to that, the average JQ public out there?
Well, I think the average GQ public needs to hear from its elected leaders, from the governor, from the public health authorities on what the plan is. I mean, don't just get up there and say this is a flu, this is a mild illness. One, it's not true, and people in Oklahoma are pretty smart. They'll figure that out pretty quickly. And second, explain what the risks are. These are the 3 vulnerable populations that we have to worry about, and here are the steps that we're doing to mitigate that. That's what people will appreciate.